Hello, my name is Nanajwa Fonu, a student at the University of Health and Allied Sciences, studying biochemistry and molecular biology at the School of Basic and Biomedical Sciences, Department of Biomedical Sciences. Today, I'm here to educate you on coronary heart disease, some of its risk factors, the pathophysiology, and how it can be prevented. Don't be in a hurry to go anywhere. Sit back, relax, and enjoy. Do you know that cardiovascular diseases are the leading cause of death globally? An estimated 19.8 million people died in 2022 from cardiovascular diseases, representing 32% of all global deaths. 85% of these deaths were as a result of heart attacks and strokes, as reported by the WHO. Recent global burden of diseases analysis reports hundreds of millions prevalent cases of coronary heart diseases and 9 million deaths annually. What are cardiovascular diseases? They are diseases that affect the heart and the blood vessels. There are four main types, namely the coronary heart disease, the cerebrovascular heart disease, popularly known as stroke, the peripheral arterial disease, and congenital heart disease. But in this video, I'll focus on the coronary heart disease. Let's talk about the basic function of the heart. The heart is a strong muscle responsible for pumping blood to all parts of the body. But mind you that it also needs blood to survive. So the coronary arteries are mainly responsible for the supplying of oxygenated blood or oxygen-rich blood to the cardiac muscle. Are you aware that these coronary arteries could be blocked? Yes, they can be blocked. This blockage can result in reduced oxygen-rich blood flow to the heart muscle or can even stop the flow of blood to the heart muscle. And this leads to a disease called coronary heart disease. Coronary heart diseases are mainly caused by atherosclerosis. Atherosclerosis is basically the accumulation or buildup of fats, fibrous elements, and inflammatory molecules in the large arterial walls. There are two main risk factors involved in this disease. They are non-modifiable risk factors and modifiable risk factors. The non-modifiable risk factors are the risk factors that you can't change or alter. Examples are 1. Age. As you age, your chances of getting the coronary heart disease increases. 2. Gender. The male sex is at risk of getting the disease than the female gender. 3. Family history. The other risk factor is the non-modifiable risk factors. These risk factors can be changed or altered. Examples are 1. Dyslipidemia. 2. Hypertension. 3. Obesity. 4. Diabetes. 5. Physical inactivity. Every coronary artery has an inner lining, a middle lining, and an outer lining. It also has a lumen which allows for blood, cholesterol, and other things to pass through. Atherosclerosis is a chronic process which is characterized by fat accumulation, inflammatory molecules, and fibrous elements in the walls of the coronary arteries. This results in the formation of a hard plaque which narrows the blood vessels and thereby reduce the flow of blood to the heart. Atherosclerosis starts to form when the cells in the inner walls get injured. This injury occurs as a result of continuous exposure to the risk factors, example, hypertension, tobacco use, and high blood glucose. Example, hypertension, which is a chaotic movement of blood in the blood vessels, can cause the injuring of the cells of the inner walls, thereby allowing LDL cholesterol, aka bad cholesterol, to accumulate in the middle space of the blood vessels. Continuous exposure to these modifiable risk factors and non-modifiable risk factors will allow for more accumulation of the LDL cholesterol. The accumulated LDL cholesterol in the middle space will be oxidized. The oxidation of the LDL will signal for monocyte expression and adhesion molecules to be expressed at the cells of the inner walls. The monocytes will adhere to the adhesion molecules and migrate into the middle space of the blood vessels. The monocytes which have been migrated will be turned to macrophages, which will eat up the LDL cholesterol. After eating up the LDL cholesterol, the macrophages will now form foam cells. The foam cells are just made up of dead cells and then LDL cholesterol. Continual exposure to the risk factors will allow for this process to continue and then will allow for the expression of cytokines like interleukins and then tumor necrosis factor. The smooth muscle cells in the middle space of the blood vessels will move to the inner lining of the blood vessels and will form a hard fibrous cap made up of collagen. This will gradually form a hard plaque, and the plaque will continue to increase in size as time goes on. This increase in the plaque will eventually lead to either narrowing of the blood vessels or the blockage of the blood vessels, and it comes with two clinical symptoms. The first one is angina. The angina is chest pain. This occurs in the initial stages of the atherosclerosis formation. And then 2, myocardial infarction. It occurs when the blood vessels is totally blocked, thereby preventing the flow of blood to the heart muscle. How can this disease be prevented? 1, we can prevent it by bringing up policies to reduce tobacco use. 2, we can prevent this disease by continuous involvement in physical activity, reducing salt intake, and then by reducing the hypertension by taking your drugs regularly. Take note that consistent involvement in physical activity and intentional healthy diet would play a key role in preventing this disease. Do you know that psychosocial factors like stress, anxiety, and depression could worsen the formation of these atherosclerotic plaques? It is advised to be involved in activities that will reduce stress. I hope this video was an educative video. Don't forget to like, to share, and to subscribe.